I'm Sophia. I'm a second year advanced clinical practice student at Columbia University School of Social Work.
Hi, I'm Gwen. I'm also a second year advanced clinical practice student at Columbia University School of Social Work. Today we're going to be demonstrating focusing oriented expressive arts therapy through a role play between a clinician and a client.
The client is a 10-year-old girl named Lizzie. She witnessed a man jump in front of the subway tracks and die. She is traumatized from the experience, and she's seeking individual treatment with an expressive arts therapist. Her trauma symptoms include difficulty sleeping, nightmares, bedwetting, and separation anxiety from her parents.
The session that we're going to be role playing is our third session together. The first two sessions focused on engagement, and now the clinician is ready to introduce the intervention. We'll be focusing on a FOAT mindfulness breathing exercise, as well as an expressive arts therapy exercise called Clearing the Space with the Arts.
Our session is going to begin now. Thank you.
Hi Lizzie, how are you today?
I'm okay. How are you?
I'm fine, thanks for asking. So I wanted to introduce two new exercises for our session today, if that's okay with you. I think that these exercises might be really great to help you feel, to help with some of the issues that you've been having when you've been trying to go to sleep and having a really hard time with that and having some bad nightmares. How does that sound to you?
Okay, that sounds good.
Okay, great. So the first exercise is a breathing exercise. And this will be really helpful. I know the past couple sessions you've talked about feeling really panicked and feeling like you can't fall asleep because you're really scared. You also mentioned having bad nightmares about being back on the subway track. So I wanted to introduce this breathing exercise that kind of can help to recenter you and calm you down. So we're going to start our exercise by just taking 3 deep breaths in through your nose and out through your nose or your mouth, whatever feels best for you. Okay, so I'll just demonstrate it just so you know what we're doing. So we're going to take a deep breath in and out through your nose or mouth. Can we do that together for 3 times? Okay. Breathe in. So we're going to start our exercise by just taking 3 deep breaths in through your nose and out through your nose or your mouth, whatever feels best for you. Okay, so I'll just demonstrate it just so you know what we're doing. So we're going to take a deep breath in and out. Can we try doing that together for 3 times?
Yeah.
Okay. How did that feel?
Better. I think I feel more relaxed.
Okay, good. So it's really important when you're doing this kind of an exercise to really focus on your breath as it's going into your body and your breath as it's going out of your body, because that can kind of help to calm you down and make you feel more peaceful. When you breathe like this, it's sending a message to your brain, and it's telling your brain that you're safe and that you're in control of your body. So that's how it helps to calm you down a little bit.
Okay.
So now we're going to continue to do this exercise. If you want to, you can close your eyes or you can keep them open, whatever you're most comfortable with. And this time when you're breathing, I really just want you to make sure that you're aware of how your body feels and any thoughts that go through your head. When you breathe in, I want you to say to yourself, breathing in, I'm aware of breathing in, and breathing out, I'm aware of breathing out. So let's try that. Breathing in, I'm aware of breathing in. Breathing out, I'm aware of breathing out. Try that a couple more times. And now I'm going to ask you to keep on breathing, but this time when we breathe in, we're going to breathe in a sense of safety and breathe out a sense of calmness. So you can say to yourself, breathing in, I feel safe. And breathing out, I feel calm. You can shorten this by saying in, safe, out, calm. Try that a couple more times to yourself. Now, as you're breathing, I just kind of want you to focus on how your body is feeling and any thoughts that have gone through your head. How does your body feel? Does it feel anxious? Does it feel tight? Does it feel relaxed or hyper? Whatever it is, just notice it and let it be.
Okay, I think I feel a little bit better.
Okay, great. So now you can bring your attention back to the room, and I know that takes a lot of concentration, so feel free to stretch or get up or just do whatever feels good for you.
Okay.
Okay, and when you are ready, if you can draw or create how this exercise made you feel using these art supplies.
Okay.
Can you share anything with me about what you just created or how this exercise was for you?
Well, I think I like the breathing exercise. It sort of remind me of when I do yoga with my mom. We do that together sometimes. And then for the picture, I used light colors because it reminded me of being happy and feeling good. And so then I drew a picture of my family and me at the beach because it's my favorite place to go to. And I was thinking of the beach when I was doing the breathing exercises.
That's great, Lizzie. It sounds like this exercise really helped to make you feel calm and bring you to a happy place like the beach where you go with your family. Do you think you can try to do this exercise on your own whenever you're feeling scared? I know that's a lot of the time at night, like what we've been talking about when you're trying to go to sleep. We'll always practice it together in sessions, but if you could try to do this on your own, I'd love to check in with you about that.
Yeah, I think I can try it.
Okay, great. So we'll begin next session next week by checking in as to how that went for you. Okay?
Okay.
All right, so I want to introduce one other exercise that we're going to do today together. It's called Clearing the Space with the Arts. So I'm sure, as you know, we as human beings, we often have all sorts of feelings and experiences that can be really stressful and painful, right?
Yeah, like when I saw that guy jump in front of the train.
Yeah, exactly. I know how scary that was for you. So I want to do this exercise. It includes the creation of a safety box. So this is your own safety box. You can decorate it however you want, and you'll add in all of those bad feelings and bad experiences into your safety box, and we'll do a little activity with it once you're done creating that, okay?
Okay.
Okay, I'm done?
Yeah.
Okay, so now what kinds of feelings or experiences do you want to add to your safety box? It can be anything that you've felt that you don't want to feel anymore. And you can use any of the art supplies to represent those bad feelings and experiences.
Can I use some of the paper cranes that I made in our other session?
Yeah, absolutely. I actually brought them today just so that you had them here. So you can feel free to use those as well.
Okay.
Also, you can share with me those feelings and bad experiences, or you can just know what they are and put them in the box, and we'll do our activity, whatever you're comfortable with.
Okay. So this worry is about me falling on the tracks, the subway tracks. And this one is about never seeing my parents again. And this one is about how I felt when I saw that guy get hit by the train.
Mm-hmm.
But I think that's all I want to share right now about them.
Okay. Well, thank you for sharing. I know that those are really scary thoughts to have. So now that you put all of your worries and your bad feelings and experiences into the box, I want you to close it.
Okay.
And if you can find somewhere in the room that's away from you to put the box, you can go ahead and do that.
Okay. Okay.
So I just want you to take a moment to notice how your body feels now that you've put all of those bad feelings and experiences away from you and in the box.
Well, I think I feel better because I can't see the box anymore.
Good. That's good, Lizzie. So the next part of this exercise, you can keep your eyes open or closed, whatever you feel comfortable with. And I just want you to imagine that you have this light inside of your body and that it's shining really, really bright. And this space in your body is this space that feels all fine now that you've cleared the space from all those bad feelings and experiences by putting them in your safety box and putting it away from you. I just want you to notice how your body feels or what thoughts you're having, and just let them be. Acknowledge those feelings and don't question them. Just let them be. When you're ready, you can open your eyes and bring your awareness back to the room. Okay? So I want you to focus on how you're feeling right now, in the present, right this very moment. And if you can try to think of a color or a sound, an object, a word, anything that describes or kind of fits with how you're feeling right now, pick that. Take your time. I want it to make sure it feels right for you. And once you've picked that, you can describe or create this sense of feeling any way you want, through more artwork, through movement, through words, dancing, whatever feels good to you.
Okay, can I do a yoga pose?
Yeah, absolutely. I like your take on this, Lizzie.
Okay, I'm gonna do warrior because it makes me feel safe and strong.
Great. So is there anything else that you want to share with me today about how these exercises made you feel, or any questions that you have?
No, I think I feel better now, but I think I'd rather share more next week.
Okay, all right, great. Well, it looks like our time is about up for today. But we'll start next week by checking in as to how the breathing exercise went for you at home, and we'll practice our breathing exercise, and then we'll also add whatever you want to your box. How does that sound?
That sounds good.
Okay, great. Have a good week, Lizzie.
Thanks.